Low-calorie diets have long been embraced as an effective strategy for weight management, metabolic health, and the prevention of obesity-related diseases. They are often recommended to reduce fat mass, improve insulin sensitivity, and lower cardiovascular risk. However, recent research suggests that prolonged calorie restriction may have unintended consequences for skeletal muscle mass, leading to greater losses than previously anticipated. Understanding the mechanisms behind protein breakdown, metabolic adaptation, and aging-related muscle loss underscores the importance of balancing energy restriction with strategies to preserve lean tissue, optimize metabolism, and support long-term health outcomes. One of the primary concerns with extended calorie deficits is the effect on protein metabolism. When energy intake falls below the body's needs, the body increasingly relies on endogenous stores for fuel. While fat is the predominant energy reserve mobilized during caloric restriction, skeletal muscle protein is also catabolized to provide amino acids for gluconeogenesis and other vital processes. Studies indicate that in prolonged or severe calorie deficits, muscle protein breakdown can accelerate, particularly if dietary protein intake is insufficient. This contributes to reductions in lean body mass, which in turn can compromise functional strength, physical performance, and metabolic health. Metabolic adaptation is another factor influencing muscle loss during low-calorie diets. The body responds to sustained energy restriction by lowering resting metabolic rate, reducing thermogenesis, and conserving energy to protect vital organs. While these adaptations help survival during periods of low energy intake, they also create an environment in which muscle catabolism is favored over preservation, particularly in older adults or sedentary individuals. The combination of reduced energy availability, lowered metabolic rate, and insufficient anabolic signaling can accelerate the loss of muscle mass, leading to diminished physical function and a potential increase in fat-to-lean mass ratio, even when total body weight decreases. Aging compounds the challenges of preserving muscle during caloric restriction. Sarcopenia, the age-related decline in skeletal muscle mass and function, begins in the third decade of life and accelerates after the fifth decade. In older adults, reduced anabolic responsiveness, hormonal changes, and decreased protein intake make the muscle more vulnerable to the catabolic effects of low-calorie diets. Research indicates that even moderate calorie restriction without targeted strategies to preserve muscle can exacerbate sarcopenia, leading to reduced mobility, increased risk of falls, and diminished quality of life. These findings highlight that energy restriction strategies must be tailored to age, activity level, and nutritional status to avoid unintended negative consequences. Despite these concerns, there are highly effective strategies to mitigate muscle loss during low-calorie dieting, turning what may appear as a limitation into an opportunity for optimizing body composition and metabolic health. Adequate dietary protein is essential. Studies consistently show that higher protein intake, particularly from high-quality sources, supports muscle protein synthesis, offsets catabolism, and helps maintain lean mass even in energy deficits. Distributed protein intake throughout the day, combined with resistance or strength training exercises, enhances anabolic signaling in skeletal muscle, ensuring that energy restriction primarily targets fat stores rather than muscle tissue. Resistance exercise also plays a critical role in preserving muscle during calorie restriction. Mechanical loading stimulates muscle protein synthesis, maintains neuromuscular function, and promotes metabolic health. When paired with sufficient protein intake, resistance training can significantly attenuate the muscle loss typically observed during weight loss interventions, enabling individuals to improve body composition, maintain functional strength, and support metabolic rate despite a prolonged calorie deficit. Cardiovascular exercise, while important for heart health and fat loss, should ideally be balanced with resistance training to protect skeletal muscle integrity. Another positive perspective is that moderate, gradual calorie restriction can yield fat loss while minimizing lean tissue loss. Rapid, severe energy deficits tend to exacerbate muscle breakdown, whereas slower, sustainable reductions in caloric intake allow the body to adapt more effectively, preserving muscle mass and supporting metabolic stability. Combining this approach with nutrient-dense, protein-rich meals, sufficient micronutrients such as vitamin D, calcium, magnesium, and omega-3 fatty acids, and strategic timing of protein intake can further enhance muscle preservation and functional outcomes. Long-term low-calorie diets also offer systemic benefits that indirectly support muscle health. Improved insulin sensitivity, Reduced inflammation and enhanced cardiovascular function create an internal environment that favors efficient nutrient delivery, muscle repair, and recovery. By integrating careful nutrition, exercise, and lifestyle strategies, individuals can achieve fat loss and metabolic improvements without sacrificing the functional strength and skeletal integrity necessary for long-term health and aging resilience. Ultimately, the emerging evidence underscores that while low-calorie diets are effective for weight management and metabolic health, they carry an inherent risk of greater than expected muscle loss if not carefully managed. This emphasizes the importance of combining caloric restriction with adequate protein intake, resistance exercise, gradual energy reduction, and age-appropriate strategies to preserve lean tissue. Viewed positively, these findings provide an opportunity to design more sophisticated, individualized weight loss programs that not only reduce fat mass, but also protect muscle, maintain metabolism, and support long-term functional health. By approaching calorie restriction thoughtfully, individuals can achieve the dual goals of improved body composition and enhanced metabolic resilience, ensuring that weight loss interventions strengthen overall health rather than compromise it.